Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking to Dr. Lauren Deville of Tucson Natural Medicine Center in Tucson, Arizona. Dr. Deville is board certified to practice medicine in the state of Arizona. She received her NMD from Southwest College of Naturopathic Medicine in Tempe, Arizona. Welcome, Dr. Deville.
Thank you. Good to be here.
Dr. Deville, please tell our viewers a little bit about yourself and your practice in Tucson.
Okay. Well, I'm a naturopathic doctor, and that means that I am trained to be a primary care physician. And so I essentially can do whatever a primary care can do, with a few exceptions. But for the most part, I deal with basic blood work. I deal with the majority of your typical issues, such as hypothyroidism and hormone imbalance and fatigue and GI disturbance and all the rest of that sort of thing. I'll see a lot of that sort of thing. And, you know, the only real difference is that I'll typically focus more on the least invasive therapies first, which means that I will pay attention to diet and lifestyle issues before I'll start prescribing drugs. And a lot of, basic stressors that people deal with on a day-to-day basis and figuring out how to rearrange those as well. Some nutritional supplementation and botanicals and homeopathy.
Now, I know a lot of your patients and a lot of our viewers know what a naturopathic doctor is. So maybe you could give us the short definition for someone who's not exactly sure what is a naturopathic doctor.
A naturopathic doctor is a primary care doctor that focuses more on diet and lifestyle and tries to go with least invasive therapies and also attempts to discover the underlying cause of a condition as opposed to treating the symptoms. That's the biggest difference between the two. And also the way that our interviews work is I'll take the patient in for an hour new patient visit, new patient consult, and we'll go over the entire background. And that way we can hopefully get a better idea of what the underlying triggers are.
So let me ask you, how long have you been practicing as a naturopathic doctor?
I've been here for almost 3 years.
So let me ask you then, what advice would you give someone who is looking for a naturopathic doctor in the Tucson area?
It's a good question. I would say that sometimes, to some degree, it's going to depend on interpersonal rapport, and so that may have some influence depending on who you're looking for. It'll also depend on what your concern is. So if you're looking for somebody that, for instance, does cancer, there is another naturopathic oncologist in town that I refer to for that. There's another naturopath that specializes in Lyme disease, and so I'll refer out for that as well. If you're looking for something that's more along the lines of women's medicine, then I would be a good person to come to for that, or hormone imbalance or gastrointestinal issues. So it's going to depend not just on what your issue is, but also on who you feel like you click with best, because it really is a relationship.
Well, that leads me into my next question. In your professional opinion, what's the single most important thing that anyone should be looking for when they want to go to a naturopathic doctor and have a good experience?
I think that the most important thing that you should look for when going to any doctor is finding somebody who's going to listen to what's important to you and who will take the time to address the concerns that you have, as well as looking over the whole picture and making sure that nothing gets missed. So the rapport and having someone that's really there and available is important.
Previously, you talked about several different things that you treat. Could you talk to our viewers a little bit about what's the most common issue you're currently dealing with?
Well, I deal with an awful lot of things, and also the majority of my patients come in with more than one concern, so it's a little bit hard to answer that question. But I'd say that one of the things that I deal with very frequently is fatigue. And another thing that I deal with very frequently are gastrointestinal disturbances, such as IBS. And so there's different ways that we would treat that. All those are symptoms, and they can be caused by a variety of different things. So it would be a matter of identifying what the underlying cause is for the individual.
Well, let's explore those a little bit further. Let's talk about fatigue first, and then we'll talk about the gastrointestinal issues. Let's say that somebody came to you with fatigue symptoms. How long does it take before they start seeing some positive results after they've seen you?
The majority of them start seeing some positive results within the first visit. It sort of does depend on the reason behind it. There are some cases that are a little bit more complicated. Either they're severely fatigued, and even some of those, honestly, I'll have people come in and say they can't lift their arms above their heads, and within a visit or so they're better. And it's a progress. They'll feel somewhat better, and it will be a couple months or so, a few weeks at least, before they start feeling like they're totally back to normal. It depends on the case. But usually they'll notice some difference pretty quickly.
Now, gastrointestinal issues sounds a little bit more complex, so could you talk a little bit about that?
So GI disturbance, a lot of times people will come in with constipation, diarrhea, gas, bloating. Sometimes they'll already know that they're coming in with a diagnosis of gut or with SIBO or something along those lines. They have a hard time digesting meat. So a lot of times what I'll do is not just take the complete history, but I'll send many of them home with a diet diary, and that helps me to identify if there's a food sensitivity that's an underlying cause, or dysbiosis, which is an overgrowth of bad gut flora that may be contributing as well. Sometimes I'll do a stool culture if we have to go there. I'll send people for blood work if it's necessary. Usually for GI disturbances, that's not the first line of defense. It can do a blood test for food allergies. It does depend on what the case is as to what seems to be most appropriate, at least in hierarchy. Sometimes we'll end up doing all of the above, depending on how complex the case is.
I see. Well, let's say that one of our viewers had either one of those issues, and they came to your office. Can you kind of talk us through the experience from the time they come in the door till the time they actually see you for the ailment?
Okay. Yeah, I try to run a pretty tight ship, so most of the time you'll come in within about 5 to 15 minutes of your visit time. Usually I don't make you wait too much longer than 15 minutes. I do my best in order to try and make that run smoothly. And then the new patient paperwork is really comprehensive. It's 9 pages long, so usually I recommend that people download it from my website and fill it out in advance. But if you choose not to do that, you can always come in about 15 to 20 minutes early and do that. And then we'll bring you in. Like I said, the new patient interview is about an hour long, and that hopefully will cover all of the possible issues that we need to cover. Sometimes people come in with very complex cases, in which case we'll prioritize and say, okay, we're going to deal with these couple of issues the first visit, and then we'll kind of peel back the layers of the onion, as it were, from that point forward. And then the follow-ups are about 30 to 45 minutes, depending. The 45 would be extended, and the 30 is more of the typical.
Dr. Deville, you have given our viewers a lot of great information about the naturopathic process and of course, visiting a naturopathic doctor. I know you do some very special things for new patients, people that have never actually been to your office to see you. So are you currently offering anything new patients?
Well, I do a free 15-minute phone consult, and that is just a way for patients to get to know me and me to get to know their case a little bit, and they can tell me more about what's going on, what they've already tried, what has or hasn't worked, and then I can give them an idea of A, whether or not it's something I treat, and B, if that's something that we feel we could work well together with. And I'll give them an idea of how I would approach that case. And a lot of times that helps people to know whether or not we're a good fit before they invest the time and the money.
Now, is that a phone consultation or is that in person?
No, it's a phone consult. Mm-hmm.
I see. Okay. Dr. Deville, you have given our viewers a lot of great information. I'd like to thank you for being on this interview and sharing your time with us.
Thank you very much for having me.
Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking to Dr. Lauren Deville of Tucson Natural Medicine Center in Tucson, Arizona. If any of our viewers would like to get more information from Dr. Deville, please refer to the phone number at the end of the video. Dr. Deville, thank you again.